Hello, hello. Welcome everyone to our PMHNP Would You Pass Lock It In live review. But before we proceed, let's wait for people to come in because this class is very interactive. Hello, please come and join us today. This session is free. It is live. We'll be talking about test taking strategies. So if you're preparing for the board exam, this session will be really great for you. So like, subscribe, share on your social media platforms. Hi, Deepika, welcome back again. Okay, so welcome everyone to our PMHNP Would You Pass Lock It In live review session. My name is Ledi, and I am a board certified psychiatric mental health nurse practitioner. Later on, Dr. Pedro Morante will be joining us later. Hi, Lucretia, welcome back. Hi, Jan, welcome back. Yeah, someone will drop the link of the book on the comment box. Okay. So, as for those who've been here before, I recently went through the journey of myself preparing for the board exam, and I understand that the stress, anxiety, and then that can cause panic sometimes or anxiety for in preparing for the board exam. So, our goal in past review is to simplify the difficult concepts, strengthening your test taking strategies, and help you build the confidence you need to walk into your exam ready to succeed and take it in one take. So, tonight we'll work through our board style questions, discuss high yield topics, and learn how to think like the ANCC exam, right? So, remember, this is a judgment free learning environment. So, getting questions wrong here simply means you're learning them before the test day. So, this session is completely free. So again, feel free to share this live review with anyone you know who is preparing for the board exam. You're also welcome to share it with your classmates, colleagues, or anyone that you think may benefit from these review sessions. So the more people we help, the stronger our PMHNP community becomes, and the more we can do this live for everyone. So if you find this session helpful, please go ahead and follow us. Follow our page, subscribe, join our mailing list so you don't miss on future live reviews. Okay. So also, I would like to talk about our PMHNP study collection. When I was preparing for the board exam, I used the Rise with Pass. It's really good. It has a lot of graphics that's easily and a lot of mnemonics, so it's easy for you to remember, important high yield questions that are high yield topics that may come out of the board exam. Um, right now, if you are attending our live reviews, you can avail of the 10% discount. So use the coupon PASS10. Hi, Rose. Yes, we will send it later. You can go ahead also to scan the QR code. And don't forget to use PASS10 to avail of our 10% discount. And if you like our study sessions, if you are enjoying this, go ahead and join us on June 27th on Saturday from 8 a.m. to 2 p.m. for a one-day last-minute prep. Walk in, walk out, exam ready. We'll be talking about high-yield questions. So we only focus on what we think are heavily tested on the board exam so you don't have to panic, okay? And then it's 6 hours. It's live. It's going to be me and Dr. Morante. It's high yield. You're going to be walking into the testing room. We're going to be talking about how to prepare for the board exam, what to do before the exam, the day before, the night before, a week before, and during the day of the board exam, so you don't panic. Okay. All right. So are you guys ready? Go ahead, take a deep breath, grab your notes, and stay engaged. Okay, we would like everyone to stay interactive on this. So whenever we're going to ask questions, I'm gonna give you time to type in your answer on the comment box. So you remember, You do not need a perfect score to pass. You only need a passing score, okay? So you don't need to have a lot of anxiety. After this review sessions that, I know a lot. I thank everyone who are coming every time we go live. Thank you so much for joining us today. So again, now let's lock it in and find out. Would you pass? Okay. Let's go ahead and proceed to our first question. A 50-year-old woman has been taking phenelzine for treatment-resistant depression. What is phenelzine? Okay, during a clinic visit, she reports difficulty concentrating and asks whether she can take medication for attention problems. Which medication is contraindicated while taking a MAUI? Phenelzine is a MAUI. Letter A, ibuprofen. Letter B, acetaminophen. Letter C, methylphenidate. And letter D, naproxen. Again, what are your keywords? Treatment-resistant depression, phenelzine, which is a MAUI, MAOI. Okay, let me give you a test-taking strategy. Look at their options, look at their choices. We know what ibuprofen is. What is it? It is a pain medication. It is an NSAID. Letter B, similar class. Letter C, methylphenidate. What drug class does it belong? And then letter D, naproxen. What drug class that is belong? So if you look at the choices, you may not know, but the choice is going to give you a hint. Maybe look at what's different. Yes, the answer is letter C, methylphenidate, which is a stimulant. So MAOI combined with stimulants may precipitate hypertensive crisis due to excessive catecholamine activity. So like again, sometimes they will throw in a lot of questions you don't know, that you don't understand. Like I had weird questions on my boards, but then I realized those were not, they're not scored. You will get 25 questions on the board exam that are actually not scored. And then when I realized that that was a question, I did not panic because later on I realized I was like, oh, I know these questions. And I was like very confident when I'm answering this. Okay. So when you look back on the choices, stimulant methylphenidate is the only one which is a stimulant. All the rest were either a pain medication or an NSAID. All right. So why the others are wrong. Ibuprofen, no significant MAUI interaction. Tylenol or acetaminophen, it is actually the safest analgesic option for patients who are taking MAOI. And then naproxen, NSAIDs are not absolutely contraindicated to cases like this. So like again, sometimes the choices will give you hints. So that is one of an example of questions. All right. So when MAUI appears in a question, always think, tyramine, hypertensive crisis, stimulants, or sympathomimetics. So remember this mnemonic, MAOI plus MPH. So my arteries overinflate. So when MAUI combined with methylphenidate, there will be excess of catecholamines. Your blood pressure will skyrocket. That means hypertensive crisis. Okay. What do you get? Headache, blurry vision. And then if it's not actually controlled, patient can have a seizure. So when MAUI again meets a stimulant, think MAOI, my arteries overinflate. Eh, Stimulants and MAUIs, very bad combination. So, okay, good job, Deepika, Jan, Melissa, Lucretia. And again, thank you for joining us today. Okay, question number 2. A patient taking clozapine calls the clinic and reports a temperature of 101.8 degrees Fahrenheit and a sore throat. What is the PMHNP's priority concern? A. Neuroleptic malignant syndrome, also known as your NMS. B. Agranulocytosis. Letter C. Lithium toxicity. And letter D. Your serotonin syndrome. What are your keywords? Drop on your comment box. After your answer, drop your keywords. Let's practice identifying keywords. Hi, Dolores. Hi, Destiny. Welcome. So for this question, your keywords will be patients taking clozapine. Okay, clozapine. Yes. And then temperature of 101.8 and a sore throat. When you see an antipsychotic, you always think letter B. It's gonna be, yes, letter B, your agranulocytosis. Because clozapine can cause severe neutropenia resulting in infection. So the signs and symptoms that were given on the question were signs and symptoms of infection. And the triggering medication is an antipsychotic, okay? So clozapine, olanzapine, clozapine. So cold, look out for zero neutrophils. So why are the other questions are wrong? NMS, it requires rigidity. So the word rigidity and autonomic instability, okay? NMS is also caused by an antipsychotic, right? So, but it requires rigidity, fever, and autonomic instability. For however, on that case, it only drops signs of infection. So letter C, lithium toxicity is also wrong because it is unrelated. And then serotonin syndrome associated with serotonergic medications usually caused by your SSRIs, your SNRIs, your antidepressants. So when you see clozapine, fever, sore throat, think infection until proven otherwise. So think about your clozapine will be your it sounds like cold or clod, your fever, your sore throat, agranulocytosis. So when your ANC count drops to what number, then you will have to stop the medication and check for labs. If your ANC count is less than what? Let's practice. Go ahead and drop on your comment box. When your ANC drops to, yes, below 1,000. Okay, below, no. If it's 800, it's already on a danger zone. It has to be at 1,000. When it's 1,000, you have to stop. When you're at 1,500, monitor, check labs, okay? But if it's 1,000, you have to stop the medication. If it's 8, it's too late. Remember, if it's 800, it's too late. Good job. All right, let's proceed to question number 3. A pregnant patient with bipolar disorder has been taking valproic acid. Which fetal abnormality is most strongly associated with this medication? A. Epstein anomaly. Letter B. Neural tube defects. Letter C. Cleft lip. Letter D. Persistent pulmonary hypertension. Very high yield. Sometimes they would restructure this question such as someone who is taking valproate is getting counseling and is planning to get pregnant. Well, what fetal abnormality is mostly strongly associated with this medication? But the concept is pretty much the same. Okay, we have differing answers. The answer is, remember valproic acid? The answer it's gonna be letter B, neural tube defects. Okay, so valproate or valproic acid exposure during pregnancy increases the risk of spina bifida and other neural tube defects. So your the other letter A, Epstein anomaly, it is associated with lithium. It is a cardiac anomaly that can cause murmur. And then letter B, cleft lip, is usually seen in patients who are taking anticonvulsants and benzodiazepines when they were pregnant. And then letter D, persistent pulmonary hypertension is usually very rare, but it could happen to patients who gets pregnant and they're also taking SSRI. So we often hear Epstein anomaly, we often hear cleft lip and spina bifida as a complication. Let me talk briefly about pulmonary hypertension, okay? Persistent pulmonary hypertension. So before I became a psych NP, my specialty is labor and delivery. So this is my expertise. The plan is to become a perinatal psychiatric mental health nurse, nurse practitioner, and I'm getting my certification again for that one in the next few months. So pulmonary PPH and or persistent pulmonary hypertension of the newborn is rare, very rare. The percentage is really low, but serious condition that has been associated with SSRI syndrome. So usually when SSRI are taken, especially during late pregnancy, about third semester, so studies primarily examined that are as commonly associated with this condition is sertraline or Zoloft. But mind you, sertraline or Zoloft is actually a common antidepressant that was prescribed among our pregnant patients, especially if they're too unstable to be taken off medication while they're pregnant. Of course, as providers, we have to weigh the pros and cons, right? So fluoxetine, your paroxetine, your citalopram, and your escitalopram. So these are medications that are commonly associated with BPHN. So usually it appears at 20 weeks of just when SSRI is exposed at 20 weeks gestation and especially in the third trimester. So it's still very low, but some hospitals do have protocols that during delivery there should be NICU present. And so remember valproate, valley in the spine. Okay, think about neural tube defects and spina bifida. Okay, so quick compare again. Remember, valproate acid or valproic acid or valproate is associated with neural tube defects or spina bifida. Lithium is Epstein anomaly. Lamotrigine is cleft lip palate. Okay, less commonly tested, but it might come out of the board exam. But valproic acid and lithium, they're heavily tested. So think neural tube defect, valproate acid. Remember, and then lithium is Epstein anomaly. Okay. All right. Let's proceed. Number 4. A 75-year-old patient is being evaluated for early dementia. Which bedside screening tool best evaluates executive functioning? Okay. A. Mini mental state examination. Letter B. Geriatric depression scale. Letter C. Mental status examination or your MSC. Or letter D. The clock drawing test. Again, keywords. What are your keywords? Drop your answer and then drop your keywords. Heavily tested on the board exam. And you also have to master. Okay, we have differing answers. You also have to master what each part of your brain is responsible for each. Okay, remember those things. What is the answer? This is heavily tested on the board exam. Remember, your patient is an elderly, 75-year-old, okay, having dementia. So what happens when the patient has dementia? But the main keywords here is screening tool for executive functioning. That's what exactly it's asking for. Executive functioning. All right. Good job, Lucretia, Lauren, and Tiffany, and Cruz, and John. It's letter D. Remember, executive functioning, the test. Remember, an executive or a CEO, they're always mindful of their time, right? So imagine a CEO drawing a clock. So the clock drawing test or CDT assesses executive function, visual spatial abilities, and planning. Remember before frontal lobe, executive functioning, when you're making big decisions, you're like, oh my God, what's going on, right? So test taking strategy, executive functioning, always it's going to be clock drawing test. Okay, CDT. We have Dr. Moranti joining us right now.
Hello, happy Father's Day to each and everyone. Sorry, was a
Happy
little bit
Father's
late.
Day to you too, Dr.
Thank you.
Morante.
Great to see you, Ledi, and all the PMHNP students that we serve. Thank you
Yes.
for this community that we are serving.
Okay. So let's go ahead. Why the other answers are wrong? So the MMSE, it's limited assessment of executive function. Why? And then the MSc, it's basically general psychiatric assessment. But the question is executive functioning. So what screening tool can you actually use to see if there's like a problem with executive functioning? And GDS, or geriatric depression scale, that is for your depression among your elderly patients. All right. So remember, CEO, chief executive, organizers, overseas. Okay, planning, executive functioning, frontal lobe. Um, if the questions asked about planning, organization, visual spatial skills, or executive functioning, think about the clock. All right, clock drawing test. Good job, everyone. All right, let's go ahead and proceed to question number 5. But before we proceed, please don't forget, if you are enjoying our live free reviews, go ahead and join us on our last minute prep on June 27th on Saturday. Spend your Saturday with us. I'm spending my Saturday with you guys. From 8 a.m. to 2 p.m., go ahead and scan the QR code to enroll. And today we have a discount for Father's Day. Use DAD10 for 10% discount. All right. So e- either you're taking ANCC or ANNP, you can take this review class. And also, please go ahead if you're, getting benefits from these review sessions. Most of the things that we're talking here, but we talk more too. There's the masterclass, the clinical concepts are like 400 pages. You can benefit out of it. If we're not doing the free live reviews, you can go through. There will be a lot of questions there. And I do recommend, if you're nearing the board exam, what I do, like a month before of my test, I do 100 questions. No less than, I can go more than 100 questions, but I do it every day. So there will be like apps there to pass review all of our um, printed materials are actually, it has like practice questions. But if you can also, like, I'm not gonna tell which one, but you can also um buy some guides, or not guides, but those apps where you can practice questions. There will be some there out there. And do 100 questions every day. When you're not on downtime, you're not doing anything, you're eating your lunch while you're chewing your food, answer a question, right? You're standing in line when you're falling in line at Costco waiting to get gas. Yes, cruise a day, 100 questions a day. 100, because it's gonna hone your skills in answering questions. That would be my suggestion. That worked, and that by far, I'll have to ask if I can tell you here. Yes. And then another thing that I did before the board exam, I bought a lockbox. 5 days before the board exam, I studied for 12 hours. And I locked my phone, I locked my remote control of my TV and studied. No distractions. I was just like answering questions. And I think like I created, remember, if you I like to create like fun mnemonics so I remember things, and I have like an index card. So if you have like an index card, if I say high yield, heavily tested, write it down on your index card. And then whatever, like, sometimes you're driving in traffic, like get that index card and then flip it and look at it.
I agree with you, Ledi. And then also just a few reminders. If you were gonna go to Prometric, you have to bring two valid ID with your picture on it. So just don't forget about that one, and make sure your test site is controlled on the day. High protein food is good, and then also less caffeine beverages on that day
Mm-hmm.
because you don't want your heart rate to go up.
Yeah.
And then just remind yourself that you have studied enough, that you are capable of passing the board exam, and you will pass. So remember those positive mindset reframing. The day of your exam is make it or break it deal for you. So always believe that you will pass.
And then if you go on our live sessions, we're gonna share also like tips and tricks that I did. And this has been heavily I've tried it, tested and tried it, and never fails. So my habits, it really worked for me. I don't know, might work for you guys, but whenever so I was a reviewer too for the board exam in another country, and I'm also a teacher. And most of my students would tell me that actually really worked. So I don't study the night before the board exam. I get at least 8 hours of sleep. Hydrate, hydrate. I always put like a timeline. 7 p.m. the night before, no cell phones or anything. Yes, you will pass. And it's mindset, I always like I wake up in the morning like a month before. I have a habit a month before the board exam. Regardless if I'm working, regardless if I'm doing other jobs, I always like wake up in the morning and say like I imagine myself walking out of the testing center. I don't know, I imagine myself in a white coat
Mm.
walking out of the board exam. But you don't wear your white coat to the board exam. It's just me, like, like how I imagine myself. I'm already like manifesting like positive affirmations. And I tell myself I passed the board exam. I'm like imagining myself opening my phone and getting an email like you passed, you're now board certified. So those things. And then I printed out you probably see somewhere online, there is like the green checkbox that everyone is actually um posting, right, that they passed the board exam. Well, you can just screenshot that, change the name and change it to your name. I would put it in front of like I put it inside my car, I put it everywhere I see every day. Like when you wake up in the morning or in your mirror in your bathroom, print it and put it there and imagine yourself that you already got that email that you got the green check. So that's another strategy. But I mean, it's just like I'm like I try to be a very positive person, and then I try to attract abundance by saying like I'm already claiming it. So you guys should start doing that, okay? Especially if your board exam, even if your board exam is in 3 months.
Mm.
So start manifesting things, okay? You're going to pass the board. Never think that you're going to fail. Fail should not be in any of your vocabulary from now on, okay? I'm going to pass the board in one take. Not second take, one take. All right? Okay, let's go ahead and proceed to question number 5. Let's talk about the neuroanatomy. Okay, a patient experiences intense anxiety, palpitations, and trembling when speaking in public. Okay, which brain structure primarily mediates the fear response? Heavily tested. Like, I remember when I said earlier, you have to master each part of your brain and what they're responsible for. Okay, A, amygdala, B, thalamus, C, hippocampus, and D is your frontal cortex. All right, I think everyone got the right answer. It's letter A, your amygdala. The amygdala processes fear, threats, detection, and emotional responses, your fight or flight. So when you see fear, think about your amygdala. So when remember, oh my God, right? Oh my God, when you're like shocked, when you're so much fear. Oh my God, amygdala. So fear, panic, threat, public speaking, um anxiety, and then threat detection. So the thalamus is responsible for sensory relay station. Hippocampus, remember hippocampus, what do you do when you are on campus? You study, so you need to have good memory. So that's how you remember your hippocampus. And again, earlier I said frontal cortex, the CEO, clock drawing test, your executive function,
Mhm.
planning, organizing. Dr. Morante, you want to add some test
Thank
tips?
you, Ledi. I think I put also on the chat box about the mnemonics amygdala that I used to master. And also when we think about amygdala, remember fame. F stands for fear. A stands for aggression.
And aggression.
M stands for mood. Letter E stands for emotion. So FAME will be your mnemonics for your amygdala function. And it's a high yield hot topic. And when we talk about amygdala, if the question mentions fear conditioning, PTSD, anxiety, aggression, or emotional memory or threat detection, always think about amygdala. Okay. And then that's basically the importance of it. Okay.
Your anatomy is it's high yield, but they commonly question like usual things. So we've been telling you those things repeatedly. So take notes, okay? Remember your index cards. All right, let's proceed. Good
Mhm.
job, everyone. Question number 6. So a patient presents with disturbances in appetite, thirst, sleep, and sexual function. Dysfunction of which structure is most likely responsible? Remember appetite, thirst, sleep, and sexual function. Letter A, cerebellum. Letter B, amygdala. Letter C, hypothalamus. And letter D, hippocampus. Remember what I said earlier. So you already know that amygdala is responsible for fear, right? So you're gonna easily eliminate letter B. And I remembered when I said earlier, hippocampus. You already know what hippocampus is, so you eliminate hippocampus. Now you have 50% of chance of getting the right answer. And the answer is letter C, hypothalamus. So the hypothalamus regulates hunger, thirst, temperature, sleep, endocrine function, and your sexual behavior. So test taking strategy. The hypothalamus maintains homeostasis. Okay? Hunger, thirst, sleep, appetite regulation, sensory must manage sex hormones. So hypothalamus. Okay. And then if the question screams basic survival drives, endocrine control is always your hypothalamus thing. Homeostasis, balance. These are the things that we need to balance. We have to balance our hunger, thirst, our sleep, sensory control, right? The endocrine. Okay. Why the others are wrong? Letter B, again, amygdala is responsible for emotion, fear.
Mhm.
Your
Mhm.
cerebellum also are responsible for your coordination. Your hippocampus is responsible for your memory.
Mhm. I think I always remember that with hippopotamus. You remember the hippopotamus on your
Mm-hmm.
hippocampus.
Yes.
And then cerebellum, like bell,
Bell
balance. So
and
that's how I
balance.
remember it. Cerebellum, it affects your balance. Bell, balance.
And what I remember with cerebellum, I remember coordination. There's like two L's parallel than each other when they
Yeah.
do when they test you for like alcohol, right? So you have to walk straight line. So that's how I remember the cerebellum is for your coordination and balance.
And then
That's
when
what I
there's
do. I
problem
like
with
to
the cerebellum, then elderly patients will be prone for falling. So you need to
uh
make sure you institute fall precautions, and especially for patients that are vulnerable, like elderly patients. Okay.
safety, always very tested. Safety, safety, safety. All right,
Yes.
good job. Number 7. Which statement best describes the action of an agonist? Letter A, blocks receptor activation. Letter B, produces the opposite effect of a receptor. Letter C, fully activates a receptor to produce a biologic response. Letter D, occupies receptors without activity. Go ahead and answer. Type your answer on the chat box or in the comment box. So
Yes.
you also have to know what's the mechanism of action of your agonist, partial agonist, and your antagonist. Okay, yes, it's another domain. Your pathophysiology is a domain that is tested in the board exam.
Yes.
All right. Yes, letter C. The answer is the letter C. It fully activates a receptor to produce a biologic response. So the agonists bind to receptors and activate them. If it says partially activate them, of course, it's partial agonist. But if the action is reversed, then it will be your antagonist. All right. So why the others are wrong? Letter A is the action of your antagonist. It blocks it. Letter B is inverse agonist, and then letter D is partial.
Mhm.
That's your partial antagonist. Okay. Remember, agonist it activates. If it's partial, then it's partial. The name itself, right? So agonist, go on. Go ahead and activate it. It turns the
Mhm.
receptor on. It produces a response. So imagine a key that opens the lock and starts everything. That's what your
Mhm.
agonist does. Okay? Antagonist against it. So anti against the action. It blocks the
Mhm.
receptor like a tag on the lock, so no response. And Dr. Morante?
I think I remember that also like anti-hero, antagonist, right? So against
Mhm.
it. Just remember the song of Taylor Swift, Anti-Hero. And then when we're talking about medication examples, we have buspirone, which are partial agonists for 5-HT1A. I think I put it into the chat box for anxiety. Aripiprazole is a D2 partial agonist. It stabilizes the dopamine. Your brexpiprazole D2 partial agonist for depression, adjunct, and schizophrenia. And then also your buprenorphine, which is a mu opioid partial agonist for your opioid use disorder. Methadone is for your mu opioid full agonist for opioid use disorder, and benzodiazepine, which is a GABA A positive modulator, which enhances the GABA effect. So please make sure know your application for your medication. So agonist acts on, activates a receptor. Antagonist against activation, it blocks a receptor. Partial agonist, part way on, activates but not fully. Inverse agonist, inverse effect produces the opposite receptor effect. So please make sure you know your effects of your agonist and antagonist for your board exam.
Okay. Let's go ahead and
Yes.
proceed to question number 8. High yield. It may the structure of the question might be different, but the concept is the same. Okay. Letter A. A PMHNP evaluates a patient with suicidal thoughts and assesses plan, intent, access, and lethality. This information is documented in which portion of the psychiatric evaluation? All right. A. Review of systems. B. Mental status examination. Letter C. History of present illness, or letter D. Your treatment plan. A PMHNP evaluates a patient with suicidal thoughts and assesses plan, intent, access, and lethality. This information is documented in which portion of the psychiatric evaluation? You better get this right. You've
Yes.
you've learned it during your clinicals. If you don't get this right, we'll have to do a one-on-one. Okay. Yes, the answer is letter B, your MSC or mental status exam. So, suicidal ideation and thought content are documented in the thought content portion of the MSC. So, why the others are wrong? Because letter A is your physical symptoms, and then letter C is your system of chronology, and letter D is your management plan. Okay. So whenever you're doing assessment, you always have to include MSE. And every time you evaluate the patient, you always have to check for safety. Always ask, do you have any thoughts of hurting yourself? Do you have any thoughts of hurting other people? Okay. So think, the mental status exam is where you check what's happening inside the mind right now. Okay. You also have to do your review of systems. That's where you put your physical exam. Okay. So if it's in the mind, it's MSE time. Remember that when you're asking for suicide risk, you have to ask for plan, intent, means, lethality. When the patient tells you like, You know what? I'm having like weird thoughts. You're gonna venture into that, what do you mean by weird thought? Tell me more about it, right? Open-ended question. And if they say, well, I'm thinking of like shooting myself, and then so you have to ask, when are you planning to do it? Do you have weapons at home? What are you planning to use? Right? And then you have to make sure that the patient is safe. You want to add something to that,
Thank
Dr.
you.
Miranda?
Yeah, thought process is however they say things, like neologism, tangentiality, while thought content is whatever they're thinking. So those are your suicidal thoughts, homicidal thoughts, delusion. So think about thought content, it ends with letter T. So thinking process, thought process, however they say it. So those are your circumstantiality, your neologism, your flight of ideas. So whatever they how they say things and how things are being processed. So remember the main difference between thought content and thought process. Okay, hot topic.
Yes. Very, very important board exam. Like again, before we proceed, if you haven't enrolled on our live PMHNP review, the last minute prep, join me and Dr. Morante on Saturday, June 27th. Go ahead and join us. And also, if you haven't too, the best, if you still have time, go ahead and purchase the book. And even if you're not taking the board exam, the psychopharmacology and the master field clinical concepts really helpful when you're starting your own practice. All right. So go ahead and avail of your past 10 code. Use code past 10 to avail of your 10% discount. And stay on the live because we're already gonna be on our ninth question, but I might
Yeah,
drop some test taking strategies. I'm gonna give you a little bit of an appetizer to like
mm-hmm.
help you prepare for the board exam.
Great.
Okay. Question number 9. Heavily tested. So last time I talked about, about the risk factors of suicide, right? So sometimes the board exam would give you situations, and you're going to choose which one is the most vulnerable to committing suicide, right? Question number 9, which patient demonstrates the highest suicide risk? Letter A 32-year-old married woman with prior self-harm history. Letter B, a 40-year-old employed male with anxiety. Letter C, a 70-year-old widowed Caucasian male with depression. Letter D, a 28-year-old woman with panic disorder. Okay, that was fast. That's good. So this is heavily tested on the board exam. The answer would be letter C. So risk factors such as being older, male gender, Caucasian race, and Native American is also very high risk. Depression and social isolation. Yes, it's letter C. So older white male is the classic high yield suicide risk factor. But then if you feel like the choices are pretty much close to each other, what you do, you tally all of the risk factors. And whichever choice has the most risk factors, that would be your answer. So, yeah, again, old white male is a classic high yield suicide factor. So remember the mnemonic, old white male, okay? Older, O for older, L for lonely. There has been a
Mhm.
loss. D for history of depression or history of self-harm. That's another risk factor. W for white, but aside from being Caucasian, Native American is also a huge risk factor for suicide. H is hopelessness or helplessness. Letter I, isolation. Letter T, terminal thinking, like all or nothing, right? And then emotionally withdrawn. Between being male and female, male. Okay, there's a question from Rose. Will all of these mnemonics and tips be included in the review book? Also, which book do you recommend purchasing? I would recommend the bundle because I did the Rise with Pass when I was reviewing. But if you're going to start practicing, having this two, like the Master Frill and Psychopharmacology, will be very, very helpful. And I think you get a more discount.
Yes,
So,
these three books will actually give you all the mnemonics that we're presenting here. So at the back of it, you'll be able to see our high yield hot topic mnemonics. So we
mhm,
make it simple for all of you. And I agree with
mhm,
Ledi. Ledi used the Rise with Pass too during her time, but we come up with the PMHNP mastery that includes all the mnemonics that we're presenting here, and also the Master Feel, which is a good companion book that if you guys purchase our PMHNP success learning package, then you are able to utilize them to pass your board. So please utilize our on-demand videos, our live classes, wherein Ladi and I will collaborate, and also these three bundle books. They're available for you for 10% off as long as you guys are gonna apply the coupon code. So once again,
mhm.
this is available for your resources for you guys. Okay.
Yes. Okay, so remember, identify the risk factors, and if it feels like, they're so close to each other, tally them. And whichever choice has like the most risk factors, that will be your right answer.
And then
You know,
always remember for the highest suicide risk, we also always have bipolar disorder, right?
mhm,
Approximately 15 to 20% of untreated patients may die by suicide, and 25 to 60% make at least one suicidal attempt. So, what does it mean when they have bipolar disorder and they have committed suicide in the past and the higher risk for that? So, if we
yes.
rank it, we start with bipolar disorder, especially bipolar 1, depressive or mixed episode. Then your next one will be major depressive disorder. The third one will be schizophrenia. The fourth one will be borderline personality disorder. And the fifth one will be substance use disorder, particularly alcohol use disorder. So if you have to rank them from top to the bottom, bipolar disorder comes first. The lowest one will be substance use disorder, especially alcohol use disorder. But remember, know your risk factors. As Ledi said, the old white male is a high risk tail. So look at your quantifiers. So aside from that, look at the diagnosis. But if they're only asking you which one, according to the ranking based from the diagnosis, then bipolar disorder, major depressive disorder, schizophrenia, borderline personality disorder, then substance use disorder. That's according to statistics. Okay.
Mhm. There's another question for
Mhm.
the LMR last minute review. What resources do you guys provide?
So for our last minute prep, we go over the hot topics for you guys, task taking strategies, and then also it comes with this companion. So if you try to book the class and get the book, I think it will make more sense, not just the class by itself, but if you get all the resources that we are offering for you guys, then that will be a good combination. So during Ladis time, we did the lab review
The
in
live
Los
review.
Angeles. Yes. So we also cover all the main topics up there. So it's really important to get our class, our resources book, and then practice our question banks. Now it comes with predictor exams. We have 5 sets of predictor exams which can help you out know if you're ready to test or not. And our timeline, when do you need to study? Within 90 days. You have to take the boards after finishing our classes. After reading the resources, the books, 90 days. Okay, 3 months. That will be a good preparation spot. But if you are, you can plan for it for 30 days if you're doing it more consistently. But the recommended is 1 to 3 months of studying. Okay.
There's a question on Instagram. You have so many courses. Which one do you recommend to take before? So it depends on your learning style
Mhm.
and which part of your preparation you're at. I mean, I think we offer like an on demand, like on your own pace.
Mm.
The last minute review is fast paced. a fast pace, sorry, fast pace, because we are gonna focus on the very important things that's gonna be coming out of potentially come out of your board exam. Okay. And there are many things that are still fresh in my head, and sometimes, I would we may be able to like see like, oh, this might have come out of the board exam, the topics that would have been very familiar. So the last minute review, if you are if you want to focus on the high yield questions, I would recommend the last minute review. But if you want to take your time, do the on demand and purchase the books. But if you are like close and you're like right now you're panicking, I've read so many things. What topics do I have to like really focus on? I would suggest doing the last minute review. I did a last minute review. We did it live. It was like very fast paced. I felt like I had sensory overload. But then once you hear it and then you see the book, you're like, oh, I remembered it was mentioned, and I would highlight everything because they would usually tell you high yield. So you focus on those things. And also we'll be talking about, tips and strategies when preparing for the board exam.
I agree with you, and we have a fun streamline of knowing when you're ready or not.
Mm-hmm.
So you based from your predictor exams, the question banks comes with predictor exams, right? So if you get the PMHNP full success package or learning package, you have question banks on demand class, and then also the 1 hour one-on-one with us. So one thing that I highly emphasize is to check out our services and then cater to what your needs are. Are you testing within a month,
A
one
month.
week, 2 weeks, 3 weeks, 4 weeks? So we kind of like also walk you through how to do that. But I think the predictor exam can also gauge if you're ready or not. At least you need to score 70% out of those 5 sets that we prepared for you. Test A, test B, C, D, E. If you're scoring 70%, that's a good sign.
Mhm.
Remember, we wanted to make sure that you are ready before you take the board exam. Okay?
It takes a lot of discipline when you're preparing for the board exam, but you got to do what you got to do. Sometimes you have to sacrifice. I did not go out. I did not drink alcohol. I was not drinking anything like unhealthy. So I was really preparing my not just my head, like not just the information in my head, but also my body. So when I took the board exam, I tell you, I don't know. I wouldn't say I was overly confident, but I was very confident that I'm gonna pass. Like for a minute, the first 50 questions, I kind of like, oh my God, this is so hard. And then I realized there are like 25 questions that are not actually scored. But then after the 50 questions, it's like, yeah, I know that. I know that. I know that. Oh, I'm pretty sure. You get that confidence that you're knowing the right answer because you know the basics, you know your safety. Because, like, again, I'm not never gonna stop repeating myself. The board exam will only test you if you are a safe provider. So you have to master like the emergency cues, your NMS, your serotonin syndrome, okay, your lithium toxicity. What are the important things that you have to tell your patient, right? Okay, let's go ahead. And after the last question, if you stay, I'm gonna tell you a little bit about, test taking strategies and I would say, how to attack the questions,
Yeah.
right? Okay. Letter number 10. A patient states, everyone would be better off if I wasn't around anymore. Which response by the PMHNP is most therapeutic? This is not just for the board exam, this is also for your practice. Okay.
Mhm.
Letter A, you wouldn't really do that, would you? Letter B, tell me more about what you mean by that. Letter C, you should focus on your family. Letter D, remain silent. What is the answer? So, as providers, we have to be very therapeutic. What kind of question do we ask? You have to do an open ended question. When the patient says, everyone would be better off if I wasn't around anymore, then you're going to respond by letter B, asking, tell me more about what you mean by that. Okay, can you explain further? So this is an open-ended response that encourages exploration and further suicide assessment. Because why? When the patient, when there's like a safety trigger, you have to ask about your intent, the patient's intent, the plan, the timing, and who is it gonna be going to, if especially if they're planning to harm someone else. So you have to have open-ended questions, clarification, reflection, and exploration of feelings. Why letter A is wrong? Because it is leading and it's also judgmental. Letter B, it minimizes the patient's feelings. You're like shutting them off. How are you gonna elicit more and more explanation or more information if you're already shutting down the patient, right? And then silence alone may not adequately assess risk. Okay. So again, open-ended questions, clarification, reflection, and exploration of feelings. Never shut down your patient. Dr. Martin?
Yes, I think very important for your board exam is when we talk about therapeutic communication is that always making sure that we provide them also an opportunity to talk about their feelings and emotions. And sometimes you'll be faced like, okay, this could be an answer, but I think letter C could be a potential answer. And that's why it's really important to look at the mnemonics that I posted there, the TED Pies. Tell me more about yourself. Explain what you mean by. Describe how you felt when you use your therapeutic communication. What else? Pies. Know their perception. How do you see the situation? How has this affected you? Letter E stands for emotion. What feelings came up for you? And letter S stands for support or safety. What helps you cope? Do you feel safe? And open ended questions usually start with what, how, tell me, describe, explain, right? Avoid starting it with do, did, are, is, can, because this can often lead to a yes or no questions. So you only ask close ended questions if they're suicidal, homicidal, is you're screening for abuse, or you're trying to focus on a question. But on the exam, on any therapeutic exam questions, you will always be looking for most therapeutic, which is tell me more about it. How can I best
Mhm,
help you? I am here for
mhm,
you. All of those words are very therapeutic to your patients,
mhm.
and you need to focus on that. Okay.
Yeah, any question that elicits more information and more explanation. And it's funny because the more, of course, when you are a teacher, you also study. We continue to learn, then that's how we are effective as teachers. And
Mm.
sometimes unknowingly, I'm doing things like this, even with my coworkers. I'm doing therapy with my coworkers. Like someone was venting. It's just like example, like, right? I think you're going to be very effective as a psych NP because not just medication management, we also have to be therapists ourselves. So from now on, practice like asking question in a very therapeutic way. So say if someone is like venting to you about like a bully at work, and I found myself saying like, so how did that incident made you feel? Instead of like giving my advice, you have to let them decide on their own, let them express how they feel because sometimes the answers are there. And I was also told her like, well, what do you think would make you feel better? And it's just like it becomes, the more you do it, the more you practice it, the more it becomes like part of your life. And I think that should be a skill set that we should really hone as future psych and peace, right? All right, and that is our last question. Again, don't forget to follow, subscribe, sign up on our mailing list, share. If you are enjoying our free live review sessions, go ahead and share this to everyone, spread the word, I mean, because it's the only way for us to maintain our community through your support. Okay, we're on Facebook, YouTube, LinkedIn, on Instagram. Go ahead and follow past review, and then if you join our mailing list, you get a free PMHNP study guide. And then if you haven't, the resources that we are showing are very, very important. Yes.
Thank you, Doctor. Thank you, Ledi. Absolutely. Would like to emphasize for those who are getting the PMHNP mastery, and the QR code is already posted there, but you will enjoy 10%. Once again, it's very colorful. It's not like a black and white book, but it gives you an opportunity as visual learners. And we have mnemonics, right? Everything that you need to know. You can use this in your clinical practice. You can also use this while reviewing for the board. You can also use this when you're in your early phase of your career as a PMHNP, or you can also give this to somebody who needs to refresh their content areas, right?
Mhm. And
And
then, if you have group chats in your class, please go ahead and share, especially our last minute prep, our free live reviews. And like again, the only way for us to maintain this community is through your support. Okay. Oh, we ran out of time. But let me give you one test taking strategy. Okay. You
yes.
have to read the entire question and pay attention to certain words. If you see the word best, most appropriate, priority, initial, first, except, not, further teaching is needed. So, because one question can completely change the correct answer. Hi, Rose. Yes, it is on Etsy, and someone will drop the link on the comment box. And we're going to
Yeah,
have
so
more high yield questions on our last minute prep. Okay. We're going to talk about the topic and we're going to give you an example. So, there's going to be more, and then you may purchase through the app. And please go ahead and share to your classmates, coworkers, everyone. And thank you so much for your support. It's been really a
yes.
pleasure like having you guys interact here all the time. And thank you all for participating. This has been very interactive. And while I'm teaching, I'm also like studying. I'm a lifelong learner. My brain is stimulated whenever like, I'm studying or like teaching other people. That's how I maintain like my skill set as a provider. And thank you guys. Thank you so much.
Thank you. And we will see you for sure on June 27, 2026. Once again, the bundles are available. You have your PMHNP clinical concepts and then your Rise with Pass available for you. But one thing or one takeaway that I would like to emphasize for them is that it's not how fast you go to your vision to become a psych nurse practitioner board certified, but it's those small steps that you take through your journey. Remember, this is not a race, right? We're not forcing you to take the exam, the sooner the better, but we're kind of like teaching you how to break down questions, manage your anxiety, and get to your goal. And our goal, and we've been around since 2015, is to help each student get their certification and pass the board exam. And our goal for you guys is to make sure that you believe in yourself, that you will
Yes.
pass, and with the proper mindset, I think the results will be positive. And the
Mhm.
community that we're building is here to stay. So make sure you invite your friends, families, and tell them about our service. And our goal is for you guys to be all mental health providers because there's so much shortage of
So
mental health
need,
providers right
so
now.
much
A lot of
need.
patients suffer waiting for 3 months, 6 months to a year without a proper treatment. So I think this will create a greater impact to the community, which is more mental health providers, more patient serves, and greater patient healthcare outcomes. And that's what we're here for.
Yes. And thank you so much for joining us today. And see you again on our next live session. I think it's on the 25th, right?
Yes. And
But
once
we're
again,
gonna
happy
drop the
Father's
schedule.
Day to all the dads out there. You're so awesome in everything that you guys are doing. For all the moms that act as dads to our fathers, happy Father's Day. Single mom, everyone that is acting like a dad right now, you deserve some steak and some good food, and we'll be celebrating with you online.
Happy Father's Day. Are you gonna have
Happy
steak today,
Father's
Dr.
Day.
Morante?
Yes, happy Father's Day to each and everyone. And thank you, Ledi. This has been awesome. We will do this again. Watch out for announcements, but please make sure to attend our last minute preparation, 6 hours. It's coming up. Thank you.
Thank you all. See you next time.
See you next time. Bye bye.